First, Steve Ratner has charts on the impact of the health care issue for millions of Americans. And Steve, your first chart takes a look at which U.S. states use Obamacare the most.
Yeah, Miko, let me just level set for people. I think everybody may know what I'm going to say, but let me just be diligent and say it. Americans get their health care in a number of ways. About half of them, a little over half of them, get it through their employer. The rest who have health care get it through the government, some through Medicaid and others through these marketplaces. The marketplaces were created under Obamacare to allow people who don't get their health care in other ways to buy it with some help from the government. And it's been enormous take-up of it, particularly because in 2021, in the Biden administration, these subsidies were substantially expanded to cover more people at incomes. They're still very modest, but up from the bottom. And so what's happened is that between 2025, you had more than a doubling of people enrolling in these marketplaces. There are now 24.2 million people enrolled in these marketplaces. Where was the biggest increase over the last 3 years? It was in red states, 157% increase in the number of people in the marketplaces versus 36% in blue states. You can see that also over here on this map, where you see that a number of red states, Texas, Utah, and so forth, all have over 10% of their people enrolled in the marketplace. Why is this so much a factor in the red states? Because Medicaid was not expanded in many of these states. States had an option back after Obamacare was passed whether to expand Medicaid or not. The red states often didn't, so their people had less insurance, and so when this happened, they took advantage of it. And you can also see down here, if you look by Republican congressional districts across the country, almost 8% of people are in the marketplaces, whereas only 6.3% of the Democrats. So that's why Marjorie Taylor Greene is so exercised about this, is because it is heavily a red state phenomenon.
Let's talk about fact-checking some of the claims that we have heard from the White House. What can you tell us?
Well, so the health care cuts. Let me just finish on the impact on red states versus blue states. The red states use these premium tax credits almost twice as frequently as the blue states. And you can see that here. And the benefit, the average benefit in the red states is $580 a month, which is $5,700 a year is the average benefit people are getting, also higher than in the blue states. And one last point on this, if you look at the increase in uninsured that will occur based on what was passed in the One Big Beautiful Bill, both the reduction in these premium tax credits as well as the Medicaid cutbacks, you can see again that this is going to hit the red states harder. 7 out of 10 of the most affected states will be red states. And so people are waking up to this. And in fact, there was a poll, to the point Claire made about polls, there was a poll that 78% of Americans support these tax credits, and even a majority of self-identified MAGA people support these tax credits.
Senate Democrats from Arizona squared off yesterday with Speaker Mike Johnson outside of his office over an elected Democrat from their state who has not yet been sworn in. That's Congresswoman-elect Adelita Grijalva, who won her special election more than 2 weeks ago. Since then, Johnson has cited that the House is not in session, as well as the government shutdown, which came after her victory, as to why she hasn't been sworn in. That's one of his jobs, to swear in new members. Here's some of yesterday's exchange between Senator Ruben Gallego and the Speaker.
Ms. Grijalva, Rep-elect Grijalva, has not yet had a scheduled date because she was elected after the House was out of session. So I am anxious to administer the oath to her as soon as you guys vote to open the government.
You don't want to be on the Epstein discharge. How much?
It's totally absurd. You guys are experts at red herrings and distraction.
Moving along.
No, not. It has nothing to do with Epstein. The House Oversight Committee is working on the Epstein files right now, releasing 34,000 pages and more on the way.
You know, she's key to
Let me finish. The House Oversight Committee.
Come up with excuses. This is an excuse so she doesn't sign on to that.
This is absurd.
This is the longest time the House.
Do you want me to answer the question? If you ask the question, let me
actually answer the question.
So you heard Senator Gallego refer to Epstein there. That's because Democrats believe Johnson is stalling because Grijalva would be the final signature needed on a discharge petition that the Speaker opposes that would force a vote on the release of the Epstein files. We should also note that back in April, while the House was not in session, Johnson did swear in 2 Republican representatives from Florida the day after their elections. So the idea that they're in a pro forma session or not technically in active session right now is not actually a reason to not swear people in. That's why people are calling out the hypocrisy right now. Joining us now, Democratic Congressman Gabe Amo of Rhode Island. You don't have the ability to swear in your colleagues, so I won't bother asking you about that. But we are on day 9 here, and we're starting to see tensions boil over. You're seeing the speaker there try to use the leverage of not swearing in a member from Arizona to try to get these Democratic senators that are currently voting no on reopening the government to get them to vote yes, saying, all right, you want your member voted in and her constituents to have representation? Just vote to reopen the government. Are these the kind of clashes, though, that voters want to see? I mean, it doesn't feel like it helps anything.
Well, at the end of the day, what you see with my colleagues from the Senate and you see with my colleagues in the House who have shown up to work, in contrast to House Republicans who are on their extended vacation, is an urgency to deal with the shutdown, the Republican shutdown. It's very clear how Republicans can get our country out of this. They control the House, they control the Senate, they control the White House. Let's do right by the American people, deal with the health care crisis that they've created, and swear in my colleague who was rightfully elected by her constituents, and they're disenfranchising the people of Arizona in that congressional district. I came to Congress in a special election. My swearing in, Speaker Johnson's first, happened just a week after my election. That was the right thing to do. We should see my colleague, Rep-elect Grijalva, sworn in ASAP and stop the political games. And it is true that this is because of Epstein. They can come up with whatever reason they want for their obstruction here, but they are hiding something, and it's time to do the right thing.
Yeah, and I asked the speaker about this. He says, no, we're going to get to it after the shutdown is over, but that pressure is clearly mounting now. You have spent more time at home because of the shutdown, because of the fact that you haven't been in session here. Is the fact that we're on day 9 of our first full, not partial government shutdown in many, many years, is that trickling into the minds of your constituents? Do they understand fully the contours of this? And really, as we're tracking the blame game, are they playing it?
Well, at home, I've gone all across the 1st Congressional District of Rhode Island, and I've heard resoundingly 2 things. One, people understand that there is a healthcare crisis. You know, the average person on our health exchange, our marketplace, Health Source Rhode Island, would pay $1,200 more a year. That's a real cost. And families are making decisions now. This nonsense about December 31st does not compute for the household who is sitting at their kitchen table and struggling because of the cost of living crisis that Donald Trump has created to really put together a plan, a financial plan for their family. So that's one. The second is people are starting to feel the impacts. I went down to the federal building in Providence and saw that the Veterans Benefit Office is closed. This is where people who have served our nation can go and get assistance with a home loan or education assistance. That office is closed. I've spoken with people who are concerned about government programs functioning, Social Security, IRS, calling one of these offices and not being sure they're going to get the customer service that they deserve. So it is not just trickling in. If you're an affected population, you are feeling the impacts of the shutdown right now, today.
Now, to your point, Joe, on fact-checking, one of the things the Republicans have been saying is that a lot of undocumented or illegal immigrants are getting health care through our federal system. That is simply not true. They cannot get health care through Medicaid. They can't take advantage of these tax credits. None of that is true. All they can do is go to an emergency room, and under federal law, anyone who goes to an emergency room must be treated. The government reimburses the hospitals for that. But if you look at all of the Medicaid spending, only 0.4% is on this emergency room subsidy, which not just includes undocumented immigrants, includes all Americans of every sort who go there. So you're talking about a trivial amount of money that perhaps an undocumented immigrant is able to take advantage of in the healthcare system.
Yeah.
The other thing that we have to point out is that this is going to have a significant impact on hospitals, and again, something the Trump administration has not acknowledged. More than 40% of hospitals in America lose money, and an even higher percentage of rural hospitals lose money. And so what's been happening for a long time is closure of rural hospitals, very few opening. And so, again, you can see that what part of the pressure on these Republican congressmen is their rural hospitals are under enormous pressure.
Yeah, they certainly are. And that chart that you showed, again, talking about the percentage of the ER visits for Medicaid, it is such a small percentage. And let me explain. And that's not even that 0.4% is not for illegal immigrants. That's the total. And so whatever small percentage subset that is of that is how little it is. And just like Scalia, Justice Scalia said, if you're in America, then the Constitution protections apply to you. In 1986, Ronald Reagan said, if you're in America, a hospital cannot lock you out of their emergency room and let you die in the bushes. Yes, that was the radical Ronald Reagan who signed.
What we've just witnessed is a vivid snapshot of how healthcare has become not just a policy issue, but a political and social fault line in the United States. Steve Ratner's analysis lays out some striking facts. The Affordable Care Act, better known as Obamacare, is being used most heavily in red states, the very states where opposition to the law has often been loudest. Since the Biden administration expanded subsidies in 2021, enrollment in these marketplaces has more than doubled, reaching over 24 million Americans. Ironically, Republican states such as Texas and Utah now have some of the highest marketplace enrollment rates. This is largely because many of those states chose not to expand Medicaid when they had the chance, leaving the ACA marketplaces as the only real option for affordable coverage. As Ratner points out, these states also receive higher average benefits, roughly $580 a month or nearly $5,700 a year per person. That's not just political rhetoric, that's real money for real families. But this isn't just about statistics. The ongoing government shutdown and the fight over swearing in Arizona, Congresswoman-elect Adelita Grijalva expose how healthcare is tied up in broader political power plays. Delaying her swearing in isn't just procedural, it's strategic. It's connected to efforts around the Epstein files and, more broadly, legislative leverage. Meanwhile, voters are already feeling the effects of both the healthcare cuts and the shutdown. Families are facing rising costs, veterans can't access essential services, and hospitals, particularly rural ones, are under extreme financial strain. And despite claims from some politicians, undocumented immigrants account for only a tiny fraction of Medicaid spending, less than 0.5%, mostly for emergency room care required by law since Ronald Reagan's 1986 policy. All of this underlines one key reality. Behind the politics, millions of Americans, especially in red states, rely on these programs every single day. The stakes couldn't be higher.